Good morning, everybody. My name is Lisa Manaster, and I am the president of the CACNA1A Foundation. Welcome to our 2024 Creating Connections Conference. I am thrilled for all of you to experience what I know will be an incredible weekend filled with meeting, sharing, and learning. For those of you who joined us in 2022, it's so wonderful to see you again. There's so many familiar faces. And for those of you who are with us for the first time, just wait. You're going to leave here with new friends who feel like family. In addition to all of you in this room, we have about 45 people, I think, online. For our virtual participants, please make sure to put any comments in the chat, and we will ask the presenters your questions. This is the important slide. Before I dive in, I want to acknowledge my why, my daughter, Emily. She's the reason I co-founded and dedicate so much time to this organization. It's hard for her when I say I'm on another Zoom call, but Emily, I know it will all pay off someday. I love you. So our overarching goals for this weekend are to support, connect, and empower the patient and family community, engage all stakeholder groups, our patients, families, and caregivers, the scientists and researchers, clinicians, and industry, and to foster collaboration among all of them to drive research and provide individuals with CACNA1A a voice in the research process. We also hope to improve patient care. We have a few MD, PhD students and postdocs here, so I hope that they will be inspired to become CACNA1A disease specialists after meeting you all and spending some time with us. Over the next 2 days, we will hear from experts in the field, have opportunities to participate in research and make connections. Based on our experience from 2 years ago, this weekend will truly be transformative. My wish for you all is that when you leave here on Sunday, it will be with a sense of hope and optimism for the future. The CACNA1A Foundation was formed exactly 4 years ago. Today, I will provide a quick update on the Foundation's landscape, but first I want to thank our team, our scientific advisors, our board and leadership, and our volunteers who run our 5K, our community conversation virtual monthly meetups, and those who represent us as global ambassadors. This is an incredible group that helps make the impossible possible, and we are so grateful for all they do. A shout out to two special people, Sunitha and Peng Kong, who work just incredibly tirelessly for our cause. We would not be where we are without them today. Patient advocacy groups like the CACNA1A Foundation serve a vital role for rare disease patients and families by providing educational resources, support, and a sense of community. We are also increasingly at the forefront of drug development for our diseases by supporting early-stage research and development. Now, I know there are no specific drugs in development yet, and I say yet for CACNA1A, but historically, one of the barriers to drug development is a lack of research, and we are not short on that. We are incredibly proud of the research network we have built over the last 2 years. Our work to date is driven by this collective CACNA1A Foundation research network comprised of over 60 researchers dedicated to finding new therapeutics and a cure for our kids. So these are some photos from our 2022 meeting, our 2023 meeting, and then yesterday we had a 2020 meeting. Our 2024 meeting was yesterday, and we held that at the Neuroscience Center at the NIH, and we were really, really grateful that they sponsored us there. And actually later today you'll hear a summary of that meeting, and I know you're going to be really excited. It'll be really exciting. So some history. At our last conference in July of 2022, I remember looking around and seeing the researchers and the clinicians who had come to speak, casually hanging out after hours at the fire pit and the hotel bar, deep in conversation. What were they talking about? Imagine if they collaborated, the brightest minds in the world working together. Everyone brings different expertise, and the collaboration could genuinely make a difference for CACNA1A. We realized that if we were to develop a collaborative research network, we had to provide opportunities for researchers to collaborate in person. Enough with Zoom. So Sunitha, Pankong, and I arrived home from Texas and immediately began planning a science meeting. 2 months later, we hosted 48 scientists for a 2-day meeting in New York City. A year later, in October of 2023, we did it again, and then yesterday, as I mentioned. And I just lost my speech. It's truly humbling to see how many researchers have traveled from all around the world to attend these meetings and engage with us, united in their belief that together it is possible to accelerate the path to clinical trials for CACNA1A-related neurodevelopmental disorders. They are busy running labs, seeing patients, and teaching, yet they stop everything to support us. They are not only collaborating, but openly sharing their knowledge and science. I know you all join me in thanking them for their dedication to improving the quality of life for our CACNA1A community. So speaking of quality of life, last year we put out a survey called the CACNA1A Perspectives Project, and the goal was to better understand the family, caregiver, and patient experiences and needs regarding quality of life to prioritize the Foundation's research agenda. This data is important because we must fund research that aligns with the needs of our most important stakeholders, our patients and families. So we brought this information to the researchers last October, and we reiterated it again at yesterday's science meeting. So from this, I just pulled 2 of the questions, but as you can see, ataxia, balance and coordination, and communication and seizures are the most impactful and also the areas that families would, short of a cure, most like to improve. So switching gears a little bit, some other highlights from the last 2 years. We've awarded over $250,000 in grant funding, most of it focused on gene therapy. We created the International Collaborative Research Network that I just spoke about. We're developing clinical care guidelines for CACNA1A-related disorders with a group of clinicians who are experts in movement disorders, epilepsy, and hemiplegic migraines. We now have a clinical assessment research study where we are adding clinical assessments to our natural history study data, and many of you will be participating in those assessments later today. And that's to help us better understand CACNA1A-related disorders and define endpoints that can be used for clinical trials. And I don't want to get too much into the jargon, but by the end of this weekend, you're going to really understand exactly why that's all so important. So running this foundation is hard work and not without challenges. If someone was to say to me, well, what does the CACNA1A Foundation do? I'd say we advance research, we raise awareness, and we support families. Well, easy enough. However, these noble goals are also our greatest challenges. Limited funding, the need for disease awareness, and patient engagement are formidable barriers we must overcome. But we can't tackle those challenges alone. We need the united voices of our entire community. Together, we can break down the barriers and make a profound difference. So I just want to touch on these really quickly. So funding. I think I missed a slide. Funding. It's challenging to raise money from the public if they aren't touched in some way by your disease, and CACNA1A is, after all, a rare disease. As a result, we rely heavily on grassroots fundraising within our community. Many of you in this room and those participating online have shown tremendous generosity, for which we are deeply grateful, but science is expensive. We recently hired Lynn Tusa as our new development director. Lynn's in the back. Lynn will be instrumental in securing new funding sources for us. If anyone has any ideas for fundraisers or knows potential donors, please reach out to Lynn. She's eager to support your efforts any way she can. Disease awareness. The average diagnostic journey for a rare disease patient is 8 years. To raise awareness, advocate for earlier genetic testing, and ultimately find new patients, we attend professional conferences, such as the American Association of Pediatric Ophthalmologists, because that's really our first symptom, and the ophthalmologists are seeing our kids before anybody else. and the American Epilepsy Association. This is a picture of us at the American Epilepsy Association or Society meeting this past year. It was me, Jeff Nobles, who's one of our one of our board members on our scientific advisory board, and Erica Gramajo, who lives in Orlando, and she came to support us and work at our booth. I also want to give a little shout out to her son, who's in the hospital right now. So we're praying for Gabe that everything goes well. We also partner with organizations such as Combined Brain, who you'll hear from in a little bit, the Epilepsy Foundation, Global Genes, NORD, which is the National Organization of Rare Disorders, and we're members of their equivalents in Europe and Canada, CORD and Eurordis. So we really do everything we can to try to raise awareness and put our name out there, so scientists and families and doctors and everybody is aware of who we are and what we're doing. Patient engagement. As you can see here, we are a growing community. So this is just the people that are in our contact database. So we currently have 301 people in our contact database, but we know that there are hundreds, if not thousands, more out there. We engage families through our monthly Zoom meetings called Community Conversations and our newsletter, and we've just launched a program called Cure Club, organized by my co-founder, Shanna Talbert, which they'll hear more about Cure Club. Are there, Sunitha? Okay, out there's a lot of information on Cure Club, so please check it out. Oh, and yes, and Deb, right, so Deb is our point of contact for that. So, okay. So I understand that all of you here today, whether you're in person or online, you fall into the category of our most engaged families. But look at these numbers. So of those 301 families in our contact registry, only 40% of them are in our natural history study. And then we have two other types of natural history studies, the RARE-X and Citizen. And again, you'll hear more about these later today. But why is the natural history study so important? You hear us, I'm sure you've all heard us say, natural history study, you have to fill out our natural history study. It helps us better understand our disease. And when there is a treatment, who wants their kid to get the placebo? So if we have a robust natural history study, that can take the place of a placebo, so everybody can try a new drug instead when we go to a clinical trial. There's just so many, well, you'll hear more about it, but there's so much value to this natural history study. Furthermore, if pharma is going to invest in a clinical trial, they want to know that there are patients who can benefit. So there's, again, enormous value in us being able to say, we have 500 patients in our natural history study and another 500 in our contact registry. If you invest in us, we'll bring you the patients. But we need your voice to help us explain to all the others out there that we are stronger together. So, and just, we also need help. We're tired. If you're interested in getting involved, please let us know. We're a small team, a very dedicated and hardworking team, but we would love to bring more people into our fold. And if we're going to make bigger strides, we need more members. So thank you for your unwavering support of our work. We are profoundly grateful and honored that you've chosen to join us this weekend, and we look forward to an incredible time together. Before leaving the stage, I just want to extend a heartfelt thank you to our sponsors for their generous support of this event: Longboard Therapeutics, Potomac Urology, Ultragenics, Mazi Therapeutics, and Kennedy Krieger. In addition, we are forever grateful to the Chan Zuckerberg Initiative for choosing us for their Cycle 2 Rare as One grant. We deeply appreciate these companies' belief in our work and unwavering dedication to rare disease patients. Their mentorship has truly been invaluable.